As we're sitting, the muscles in the front of the legs get more tight. What are these muscles? So you can think of the rectus femoris that goes from the knee up to the hip. You can think of the iliopsoas complex, which is the iliacus and psoas that basically go from the pelvis and go all the way up to about the beginning of where our ribs are. So these muscles go very, very high up and up to our trunk. And so these are very, very powerful muscles. So these are the muscles that pull our trunk forward and also lift our legs up. You can also think about the muscle called the tensor fasciae lata, which lifts our leg up and rotates out, and that connects to the iliotibial band or IT band. You may have heard this when people talk about IT band syndrome. So all of these things are connected with the hip flexors that pull our trunk forward. And this can cause a number of problems. It pulls us forward, but then our head goes forward. So this can contribute to balance problems from the standpoint that if we're being pulled forward, then our center of gravity just kind of shifts. And then if we're in a position where we're knocked backwards or we stand upright, it's very common for people to then go backwards and lose their balance going backwards. And the question is, can they respond? And we see this with our clients all the time. Once we bring them up into a forward posture, they're straight up and down. One of the first things that they'll do is actually lose their balance going backwards. So I'm already prepared and my arm is already there in response to my anticipation of they're going to be knocked backward right now because I'm bringing them into a position that they have not been in a long time. We've stretched out their hip flexors. We've maybe done a couple other things. Maybe I use some neurological magic technique to get them straight up, and then all of a sudden they're going backwards because they're standing straight up and down for the first time in a long time.